Mitchell. I am the Commissioner of the Department of Public Health. I want to welcome everyone up here with me, especially Governor Lamar for standing with me on this very important and sensitive issue. Thank you to all of our lawmakers who are here today. I want to also welcome our colleagues from the Connecticut medical community. And I also want to thank our faith leaders who have joined us today as well. On April 1st, I was honored to be appointed by Governor Lamar at the Department of Public Health as the Department of Public Health Commissioner. I take this role and responsibility very seriously. Legislators months ago asked me questions regarding immunizations and what we should do as a state to improve immunization rates. They also asked me if we should repeal the religious exemption for the requirement for children to be vaccinated before they attend school. The answers to these questions deserve thoughtful consideration from all sides of the issues. Also, the answers to these questions require the analysis of the best science our country has to offer. No, I truly appreciate our legislative leaders for their patience while my team and I have deliberated on this very important public health infectious disease that was considered eradicated in 2000 by use of vaccinations. Before vaccines were developed, many died all over the world. Many in third world countries are still dying from such diseases that we as a nation with the science eradicated. Now measles has begun to breach our healthy communities and we cannot allow it. Herd immunity protects all, especially the children whose immune systems are compromised and cannot be vaccinated. I know there are many who sincerely believe that the religious exemption should not be repealed and vaccine rates by schools should not be published. I sympathize, but I must follow the science that has been proven for more than 50 years and have saved millions of lives in our country. This past spring, at my request, the department released school-level immunization rates to inform parents and guardians of immunocompromised children, to increase public awareness, and to encourage community engagement about the public health concern. At that time, we reported an overall state measles, mumps, and rubella, MMR, immunization rate of 96.5% for 2017-2018 school year. When the data was further broken down by school level, we found that over 100 schools had immunization rates for measles, mumps, and rubella below the federal guidelines set by Centers for Disease Control and Prevention of 95%. We are seeing a troubling trend, a multi-year decline in the overall percentage of young children vaccinated for measles declined from 96.5% for the 2017-2018 school year to 95.9% for the 2018-2019 school year, a decrease of 0.6%, while the overall number of religious exemption rates to vaccinations increased 25% between the two school years. The preliminary analysis of immunization rates that are going to be released in October is already demonstrating that the immunization rates for MMR are decreasing. Measles was considered eradicated in 2000, yet here we are in 2019 with the U.S. experiencing the largest outbreak of measles in 25 years. So far in Connecticut, we have 3 cases of measles, and those cases exposed at least 600 people. As a public health official, I adhere to the science of vaccines being safe and effective in eradicating disease in humans. Everyone who can get vaccinated should get vaccinated to protect the public's health. As Public Health Commissioner, I have the responsibility to protect the public's health and to protect those who cannot protect themselves. Children going to school are entitled to learn in a healthy environment safe from disease. Therefore, after much deliberation with my team, I make the following statement as a matter of public health policy. am recommending that to protect the health of the public, the religious exemption to vaccination should be repealed by the Connecticut General Assembly. I make this recommendation at a time when we are seeing Connecticut's trends of immunization rates decreasing and religious exemption rates increasing. We should not wait until we have a serious outbreak of measles or other infectious diseases or even the possibility of death. Governor Lamar and I are proposing that this change be made effective October 1st, 2021, to give parents and children the time to adjust to the change and plan prior to the start of the school year. We believe that based on the scientifically proven data, that this is clear and necessary action needed to protect our children. This is the right thing to do. Thank you. Now I'm happy to introduce my counterpart, new commissioner at the State Department of Education, Miguel Cardona, to say a few words.
Thank you, Commissioner. Good morning. My name is Miguel Cardona. I'm the Commissioner of Education. It's very clear to us at the Department of Education that the Department of Public Health recommendation to require vaccines for school-aged children is an issue of public safety. Vaccines not only protect healthy children from dangerous diseases like measles, polio, and diphtheria, they also protect our medically fragile students and staff. In our schools, we have children and adults with weakened immune systems that are battling cancer or have other conditions they're being treated for that make them medically fragile. While I am pleased that we are currently above the 95% vaccination rate, as Commissioner Coleman Mitchell stated, the trend is indicating that in a few short years, we will likely be below that critical immunity threshold. Again, this is an issue affecting health and safety. As a state educational leader, it's my responsibility to look out for the safety of all students and staff within our schools, which is why I'm supporting this recommendation. The Department of Education continues to support the learning needs of all students, including students who currently have medical or religious exemptions to immunization. We will work closely with the Department of Public Health and our state legislators to ensure a transition that is respectful of the concerns that will be expressed. It is our responsibility to ensure a safe learning environment and a quality education for all students. Thank you.
Thank you, Commissioner Cardona. Next, I would like to invite our legislative partners in this effort, starting with Senator President Pro Tem Martin Looney.
Thank you very much, Commissioner, and thank you, Governor, for your leadership on this issue. It is something of great importance and something that we do plan to move forward on in the 2020 session, and it is important that we have the support of the administration in doing so. This issue has become ever more critical as we see, as the Commissioner said, the rates of immunization declining, the fact that we have over 100 schools that are below the ideal rates to create herd immunity, and the fact that we've been hearing from many parents of immunocompromised children who are terrified at the prospect of sending their children to school in a situation where they may not be safe, because these are children who cannot themselves be immunized because of their immune system. They cannot be safely vaccinated, so they depend on the immunity of all of those around them. And that is why the aggregate data of 95% or so is of no real help and no real comfort to those families. They need to know exactly what is the immunization level in the schools that their children attend. And that's why we need to move forward with this legislation. This is not a religious issue. It is a public health issue. And there is no valid reason for children not to be vaccinated except for a health-related reason. And that's the key, and that's the crux of this. And some other states have done this already. Others are moving in that direction. And I wanted to thank the House Majority Leader, Matt Ritter, who is here, who has been a champion on this issue, leading on it in his chamber. Our Majority Leader, Senator Bob Duff, is also a very strong proponent. In fact, Bob today is with his son on an out-of-state college visit. His son is a senior at Norwalk High School. So Bob, from the very beginning, has seen this as an urgent public health issue. And with the support of the administration, I think we will have momentum to move forward and pass this bill, as we should, as a critical matter of public health in the 2020 session. Thank you.
I also want to thank the governor for your leadership on this, for the commissioners that are here today, and for our public health chairs, to my left, Representative Steinberg, and to my right, Senator Abrams. Look, this is something where people, we saw the data last year, school by school for the first time, and that immediately created a lot of concern in the House and the Senate, and on both sides of the aisle, might I add, and in the medical community. And it's really important the medical and religious communities are here today, because I think you really speak, your role is very important here, and you speak the truth, and you speak to what you do every day and what you see in your lives. Some of us don't see the awful things you have to see on a daily basis sometimes. We have an opinion from our Attorney General that this is constitutional. Since last session, the states of New York and Maine have also done this because, again, they had measles outbreaks. So those who say it's unconstitutional are flat out wrong. The second thing that I would add is the data got even worse since last year. When the Commissioner of Public Health released the data, I don't think anybody thought you'd see a 25% increase. I think in October, when you see the school by school, my guess is we'll have more than 102 schools, well below that 95% number. So for those who say, why act now? Quite frankly, the data leads you to act now. The third thing I remind people is it's harder to get a Dunkin' Donuts credit card and to claim a religious exemption for vaccinations. I want you really to think about that for a second. You can literally check a box, turn it into your school nurse, and walk away. I have to have the ability to go through Bradley Airport and take my shoes off and not unpack my laptop. I had a 45-minute interview with my wife for that. When I walked to the Banana Republic store to get my card, it took 17 minutes to do that. I had to give a social security number. To claim a religious exemption, you can simply check a box. And more than 1,600 parents now do that for kids. And they go to public schools, and as everybody has said, put others at risk. To put that in perspective, in 2007 and 8, you had 465 children claim a religious exemption. That number has now exploded to 1,600 or 1,700, putting Connecticut, long thought of as a bastion for good public health policy, very, very close to falling under the 95%. The World Health Organization this year said that the concerns around vaccinations, the false links to autism, the incredible misleading information on social media is one of the 10 largest health risks in the world. So this is about leading. It's not about waiting for something terrible to happen. It's not waiting for a death or an outbreak to happen. It's about leading and standing up. And I want to just be very clear to my colleagues in the legislature. It's rough seas, rough seas. Some very vocal people out there. They will criticize you. They will file complaints against you. They will say all kinds of things about you. But you got to summon the courage to do what's right by the public health of the vast, vast majority of the people in Connecticut. And our job is to protect those children and those families who are going through chemotherapy or whose kids were born with an immune system does not allow them to get vaccinated. They won't be up here testifying because they can't believe this is actually a thing. They can't believe their kids be put at risk and that any of us would not stand with them. So today we stand, and we have to keep that courage going to the 2020 session. Thank you very much. The chairs, Mary, you guys want to say something? The chairs of the Public Health Committee? Or? Yeah, that'd be great. Yeah, both of you.
I'm State Representative Jonathan Steinberg, the House Chair of the Public Health Committee, the Senator Mary Abrams, the Senate Chair of the committee. It will come as no surprise that there will be legislation next year to repeal the religious exemption. And I want everybody to understand that we are going through a very deliberate process to make sure we do it as well as any state, and perhaps even better. If you're a parent, it's almost certain that you would agree with the statement that the most important thing we can do is protect our kids. And I think that's what we're talking about here. It's not a matter of putting one at risk for the many. It's the importance of taking care of the general good. Now, I've never loved the phrase herd immunity. It seems to sort of diminish the dignity of each individual. But it is a proven scientific approach to avoiding highly contagious diseases. It has saved literally millions of lives over a period of 50 years. So what we're talking about here is now radical by any stretch of the imagination. It is high time that we move the religious exemption, and we will maintain a path for medical exemption for those who are truly at risk based upon their specific health profile. So you'll be hearing more about it. Senator?
Thank you. I'm here today as one of the co-chairs of Public Health because We have the responsibility to put forward legislation and to ultimately pass legislation that protects the public good. And I think when you look clearly at what the facts are, what the information out there is, and what the Commissioner of Public Health and the Commissioner of Education have shared today, we have the responsibility to move forward with this, and that's exactly what we intend to do. Thank you.
Thank you, representatives and senators. We look forward to providing you with information you need to get the legislation passed. This is a copy of the letter that was forwarded on to the legislators this morning in regards to response to their letter that they sent months ago. I now want to invite our representatives from our medical communities, the Connecticut State Medical Society, and the Connecticut chapter of the American Academy of Pediatrics, two of our key stakeholders in keeping Connecticut residents healthy. First, I'd like to invite Dr. Stacey Taylor of the Connecticut State Medical Society. Dr. Taylor is a family practice physician in Litchfield. Dr. Taylor? Thank you.
At our founding in 1792, the Connecticut State Medical Society stated its dedication to the diffusion of science and knowledge of the healing arts. In other words, evidence-based medicine as we know it today. More than 2 centuries later, as the wealth of medical knowledge has expanded far beyond anything that the Connecticut State Medical Society founding physicians could have imagined, we remain as a trusted source of information for patients and their families. In the current environment of skepticism about the efficacy and safety of immunizations, CSMS reaffirms its support for the childhood and adult immunization schedule as recommended by the U.S. Centers for Disease Control and Prevention. As physicians, we have the obligation to protect the public health. Immunizations are a critical component of public health and safety, and CSMS strongly supports the CDC recommendations for childhood and adult immunizations. This support bears repeating, as national trends towards decreased vaccination rates have led to outbreaks of pertussis, whooping cough, measles, and diseases we did not expect to see again in our lifetimes. It is worth noting that high immunization rates thus far in Connecticut have been successful in reducing or eliminating many viral and bacterial diseases. They have protected those among us who are more at risk of getting disease due to compromised immunity thus far. Thankfully, many of us have never seen active cases of polio, mumps, German measles, chickenpox, diphtheria, or their complications. Vaccines work, plain and simple. Vaccines are one of the safest, most effective, and most important medical innovations of our time. They have saved many lives and protected others from devastating sequelae of these diseases. CSMS remains committed to raising awareness in the role of vaccines and how they protect patient safety and public health. Thank you so much.
Thank you, Dr. Taylor. Now I would like to invite Dr. Jody Terranova, a pediatrician from Windsor who is representing the Connecticut chapter of the American Academy of Pediatrics. Dr. Terranova.
Thank you, Commissioner, for inviting me here today on behalf of the American Academy of Pediatrics Connecticut chapter. We are quite pleased at your announcement today that you will support the removal of non-medical exemptions. Nationwide, the American Academy of Pediatrics' top priority is to support the removal of non-medical exemptions and only allow medical exemptions for our children so that the most vulnerable among them can be protected. We look forward to working with our legislators and providing information and support in the upcoming session of the as we know that this will be best for the children and the citizens of Connecticut.
Thank you, Dr. Turanova. Now I want to invite some of our clergy and religious leaders to say a few words. I want to start with Imam Safwan Saki from Farmington Valley Muslim Center. So Imam, would you be honored to join us and say a few words?
I want to first thank the governor's office, the commissioners who have participated in this and allowed this to occur. Special thanks to South Unberg for personally reaching out to me. I'll try to keep this short, but I'm a preacher, so bear with me. One of the things that I find, as a leader of a often marginalized minority group, you would think that the most fulfilling thing that I do is to civically engage with others, especially those who might not have the best perception of us. But actually the most fulfilling thing that I do is actually occurred yesterday, and that's Sunday school. And as any clergyman can attest regarding Sunday school or weekend schools, is the sweetness and pleasure you have when you work with children. That there is a joy that exists there. And regardless if you even profess a faith or you're speaking here on behalf of a faith tradition, you can easily see that there's a sweetness, there's a joy, and what I would say a sanctity to children. And this is something that we go at utmost length to protect and to safeguard. And this is not something that the religion is against, especially in the Islamic faith. And I can say with certainty the Prophet Muhammad in our tradition, who we attest is a messenger of God, who said, there is a cure for every disease, which 1,000 years ago might have seemed strange, when an infection can kill you. But now with medically where it's progressed so much, it's easier to see that there's truth in this statement and there's falsehood. And he said to seek treatment whenever you can. When it comes to children, when it comes to parents who look out for their loved ones, there is no exemption from the sanctity of life. All of us are here to protect each other and especially each other's children. And I understand there might be some allergy, I think might be the best word to use, speaking on behalf of a marginalized group about religious exemptions, and it might seem as if there is a restriction on that. But we as a community come together and define where is the line. And I think we can all agree that the line is protecting our loved ones, especially those younger in our communities, and that is the children. Thank you very, very much.
Thank you, Iman. It now gives me great pleasure now to invite Rabbi Deborah Cantor of B'nai Tzedek Salom Synagogue in Bloomfield to share some thoughts as well.
Thanks to my colleague and brother, Imam Safwan Sheikh. I'm honored to speak here this morning, not as a scientist, but as a religious leader who respects the work of scientists and the preponderance of scientific evidence in the matter of vaccines. I speak for myself, but not only for myself, I speak on behalf of the overwhelming majority of my community. Many of my congregants are involved in healthcare or work in schools. My own husband, Jim, is a nurse. I speak this morning as a rabbi and a mother and as someone who is knowledgeable in the field of Jewish law. One of the most basic principles of Jewish law is pikuach nefesh, the primacy of saving a life. The life of a human being is considered of inestimable value, and therefore nearly any other rule can be abrogated in order to preserve it. The ancient sages taught whoever saves a single life is considered to have saved an entire world. And the very same sentiment is found, as you know, in the Quran. Vaccines have been proven safe and reliable. They prevent or lessen the severity of many terrible childhood diseases. As a 6-year-old, I nearly died from a case of measles encephalitis. I had a robust immune system, so I was lucky and I recovered. But there are many children with compromised immune systems and other medical conditions which prevent them from receiving vaccinations. They're not as lucky as my children were. They're reliant on herd immunity. And in such cases, Jewish law is clear. Those who are healthy must get vaccinated. Those who are healthy have a responsibility to do so based on another Jewish principle, Al tifrosh min hatzibur. You may not separate yourself from the larger community. You may not endanger those who are vulnerable. While it's true there may be Jewish parents who choose not to vaccinate their children, and I know a few, there is no basis for that decision in Jewish law. On the contrary, our tradition emphasizes the importance of preventive medicine, the preciousness of life, the importance of caring for one's body, and of not causing possible harm to others. Thank you.
Thank you, Rabbi Cantor. Now I want to introduce our governor, Ned Lamar, and thank him for his continued support.
Thank you, Renee. And, good going, Marty. That's good. Hey, look, I'll be brief, and I'm not a preacher. So, but I just want to reiterate a lot of what I heard. First of all, I appreciate the religious community standing tall, explaining to their hearings why this is so important. And we respect the diversity of opinion out there. This is why we are going to put in place ending the religious exemption in a very thoughtful way going forward. And I understand, as Matt said, some of the feelings on this. We're going to have hearings. We're going to do it in a respectful way. We're going to do it because it's a public health issue. And as your governor, public safety and public health are two of my obviously overwhelming responsibilities. I'm proud to be here with the representatives of the health community, showing the unanimity of opinion that immunizations are safe and prevent preventable diseases and outbreaks. Immunizations are especially important as a public health issue because they are so contagious, the diseases which we're trying to deny, putting at risk the greater community, be it at your school or your community. And that's why we are making this a priority. I heard what Matt Ritter said, that this is not always an easy vote. Sometimes legislatures like to wait until the emergency and then act. Wait for the bridge to go down, wait for that measles epidemic. And that's not the way you deal with public safety. And here's our chance in a smart and thoughtful way to plan for a year from October that we have the end of this exemption, and I want parents to know that their kids can go to school and feel safe, that we've done everything we can to protect the public health. And to my friends Miguel and Renee, I thank you for standing tall with you. Renee said, let's do this together, Governor. Let's plan this out thoughtfully to make sure that we come forward, we know what the issues are, we know what the facts are, we can lay this out in a respectful way to all the different constituencies out there. And Renee and Miguel and I are standing shoulder to shoulder with members of the religious community, with our political leaders in the healthcare community, saying we're doing everything we can to keep your kids safe. And that's why we're putting in place my strong support for ending this exemption in the next legislative session. Thank you, everybody.
Why not? I mean, you previously, as a matter of fact, on the day that the majority leader announced that they would not be proceeding with the repeal bill, told several of us that you would have signed that legislation. And now we have your public health commissioner coming out. So why now?
I'll tell you why now. Because we've got the facts in place. We're looking at and talking to our neighboring states. I've talked to all the healthcare professionals. They told me that we could be at risk. We know that the level of immunization has gone down over the last year and over the last 10 years. And this is our time to do it. Why now? Because it gives us time to plan for this thoughtfully. It gives us time to plan for the next school year. So we're not rushing into this, but we're going to prevent something from happening before it can happen.
Commissioner, what changed? I mean, you seem to be leaning to not even releasing the data for 2018, 2019. In these past 13 weeks since lawmakers wrote you, what has changed?
I'm glad you asked that question, actually. Nothing's ever changed. At the time that I was asked, the department was asked to release data, we didn't have the data, all the data in to be released at that time. So we weren't ready to release anything until we had the full data, all the data in from our schools. So that's basically what has changed.
Was it seeing this data that made you come to the realization? Because even when Governor Lamar said this data should be released, even that day, you said you weren't going to release the data. So was it the reality of what the data showed, or?
No, I guess, again, it goes back to having all the data in. We've seen the immunization rates go down and the religious exemption rates go up. But it should have been phrased differently, to be honest with you, to say that at that time, that no school data or any data would be going out because we didn't have all the data in.
What is your concern going forward, should this pass, and what kind of scenario that will play out in many school districts? I mean, you have many parents who are very adamant about not doing this, and you could cause some real problems in many individual schools.
I can only answer that as a public health commissioner, that my responsibility is to Connecticut's public health, and I advise, I inform, and I've advised that there should be a repeal of this religious exemption, simply because this is the time to act now.
Will you be advocating? I'm sorry.
And I was going to say, and I also, I don't legislate. The policymakers do the legislation. I just do the advisement.
Will you be advocating at the legislature for this, and how does that fit in with your description earlier of your view that you should keep a certain distance from the legislative process?
I will be advocating. Now that we have the data and we see it very clearly that there's been this data where the immunization rates are, I keep saying it, but the immunization rates have gone down and the religious exemption has gone up. We see what other states have been doing. It's really given us an idea of how we go forward. And so, yes, I will be advocating to move forward on this matter. We want to act proactively. That's where public health is at its best, when we act proactively. We're trying to put everything in place so that we don't have a measles outbreak, what we've seen in other states. We've looked at the data, we looked at other states, the lessons learned, and we've deliberated a great deal in-house. And now is the time.
So if
how do you
indeed,
prevent,
as Representative Ritter said, if it's harder to get a Dunkin' Donuts credit card, I'm just wondering why not try and strengthen the existing religious exemption rather than eliminate it altogether?
I think that's a question for the legislators.
Well,
it's because we believe that no reason other than a health-related reason is an adequate reason for an exemption. No matter what you do with the religious exemption, if you were then allowing some non-health-related reason to enter into the process, and we think that is a risk to the public health. This is purely a public health matter, and no other reason should really enter into it. Children who have compromised immune systems and cannot be vaccinated need to be protected. This is an issue that we have to realize that every constitutional right, the opponents of vaccination say that their rights as parents are being infringed upon in this. That's certainly not true, because children are not chattel. They're not possessions of their parents. The parents have an obligation to care for their children. That's why we have circumstances where the government steps in and protects children who are not being properly protected. And this is a case where we have to recognize that we now have seen all over the country, there are 15 and 16-year-old kids who are appalled at the decision that their parents have made not to have them vaccinated, and are researching ways that they can try to get vaccinated despite their parents' wishes, because they believe their health is at risk, and they are mature enough to understand that. They've done some research on their own.
How do you prevent?
Can we hear from the majority leader on that question?
Yeah, I think
okay.
Marty hit it on the head. I don't, there's no, you're not gonna have a question and answer session. You're not gonna go do something under oath. It's a bright line, and you have to draw a line very clearly, as the doctors and the religious individuals said earlier, which is that this is the public health, and it's very simple. We would point out, we're not forcing anybody to be vaccinated. And I know some people say, well, then I have no ability to go to a public school. That is true. The government's not going to come in under this law that I think we propose and force vaccinations. There are statutory powers if there was an outbreak, and that's a whole different statutory scheme. But for purposes of this, we're just saying you can't enroll in public school where you could endanger other kids.
So how do you prevent legislatively then an increase in medical exemptions that really aren't medical exemptions?
I mean, Representative
Along
Steinberg,
with that, do you
they've
have
been
to?
having good meetings, I think it's fair to say. Yeah. Yeah, sure. Great. Yeah.
As part of the letter that we put forth in the answer to the legislators, one of the things that we had seen in other states that did away with religious exemption is the major increase in medical exemptions. So what we've done as a proposed option in the letter is that we at DPH, Department of Public Health, would put together and develop a form that would then have to be signed off by the physician and the parent and kept at the school for medical exemptions.
Currently, that's between the parent, the physician, and the school, not DPH,
That is
correct?
correct.
Okay.
The form is only going to be developed to be for such matters as those three individuals, those three entities.
I had a question.
Some of the parents outside who are supporting this handed us a sheet of questions, and two of them basically question whether or not, and this is, I guess, for the political leadership, whether or not the state's pharmaceutical industry, the state's interest in recruiting growing the bioscience industry is somehow at work in this movement to repeal the exemption. I just would offer you all an opportunity to respond to that.
No.
They're accusing you
Well,
of
can you
that.
elaborate a little more?
No,
Absolutely not. This shows you kind of the irresponsible arguments that get made in this regard. I have heard from no one in that industry on this issue, and nor do I expect to.
And if I might, let's say you did get rid of the religious exemption, and a couple hundred children were then received vaccination as a result of the law change. So 300 people getting vaccinated in Connecticut is going to change what for a company? It's sort of a silly argument.
Just wanted to give you an opportunity.
I appreciate it. Thank you.
Are you prepared for this? Are you prepared to? I mean, do you have the courage to take this all the way through? Because obviously there are arguments on the other side, and that they're very vocal.
I'm going to take the lead on this. We've got the facts, we've got the public health leaders, we've got the religious leaders. Most importantly, I think when it comes to public health and contagious diseases, this is something we're going to take a lead on, and we're going to make sure that Connecticut continues to take the lead on this. And I'll do that personally as a governor. I'll go to every community I can and tell them why I think this is so important. I'll keep going to the legislature because I know there's going to be a lot of pushback, and not now, maybe later, what's the rush? This is the time for us to take this right decision. It's in the best interest of our kids, it's in the best interest of our family, and we're going to get this passed.
Governor, how do you respond to legislators who ask you privately, can we just push this out of the election year cycle? Can we take it up in the 2021 session?
I hear that over and over again on every big issue that we've got to confront, and I'm not here to postpone these decisions. I'm here for us to make the right decisions, make it now. I know some of them are politically tough. I know you don't see the urgency of it. I know we can wait a little bit longer, but that's not the way I operate. And on that happy note, thanks everybody.
Good job.